Hello. Welcome. Whether you're from the north, the south, the east, the west, or the middle, if you're here to help us end the HIV epidemic, then you're my colleague and friend. There is a reason, however, that the National HIV/AIDS Strategy points out what's happening in the South. And the fact is, the numbers don't lie. We have over half of the new diagnoses in the South. We have about half of the people living with HIV in the South. And unfortunately, the saddest part of all is that we have the highest death rates in the country. So we hope to enlighten you a little bit about some of the issues that we're dealing with today. And I'll start off by introducing someone who has very quickly become a good friend of mine. She's not only brilliant and beautiful, but she has a real passion for this work. Please welcome Dr. Chanel Mccoy. She's the director of the HIV/STD division of the Tennessee Health Department. Thank you.
Good afternoon, everyone. Good afternoon. Clicker. Your slides. Yes. Thank you to Kathie, Hiers, and Carolyn McAllister for asking me to be a part of this amazing panel and bringing attention to HIV in the South. To MAC and USCA organizers and sponsors for seeing the value in dedicating time to HIV in the South. To the Southern AIDS Coalition and Southern AIDS Strategy Initiative for organizing, educating, researching, and advocacy on behalf of Southerners and truly all those affected and infected by HIV. To the National Alliance of State and Territorial AIDS Directors for your work on behalf of health departments. I am grateful for the work you do and continually impressed by how you are able to stay on the cutting edge of domestic and global strategies. To health department employees, are you here? All right. I spent nearly 15 years working in government agencies, local, state, and federal, in Oakland, Peoria, and Springfield, Illinois, Detroit, Memphis, Atlanta, and Nashville. So I know your struggles and yet how rewarding our work can be. To the Southerners, okay. Especially Tennesseans, Memphis, Nashville, Chattanooga, Knoxville, and Bucksnort. Are you here? Bucksnort, Tennessee? Okay. Thank you for partnering to create a comprehensive delivery system addressing HIV in the South, which accounts for a little over a third of the U.S. population, but more than half of all HIV diagnoses. And to everyone else, if you haven't heard it today, thank you for your dedication to this work. The days are long, the work is hard, the pay is often low, the accolades are far few, but thank you for each and every day you decide to get up and do it again. Nearly 6 million African Americans migrated between 1915 and 1975 from southern states to cities and towns in the Northeast, West, and Midwest during what is called the Great Migration. After completing more than 1,000 interviews, Pulitzer Prize-winning journalist and author Isabel Wilkerson documents the migration narratives of 4 individuals in her 2010 book, The Warmth of Other Suns. She weaves the social cultural context that was the motivation for many to migrate north. The discrimination, disenfranchisement, disinvestment, inequities, and violence in the narrative of the 3 main characters. My family's story is one of the Great Migration, from states like Tennessee, Kentucky, and Mississippi to the land of Lincoln. I have fond memories of both my Mississippi-born grandmothers. Whether you call her Nana, Granny, Yaya, Big Mama, or Medea, okay, and Abuela, I hope you too have fond memories of your grandmothers and their contributions to your lives. With their move north, my grandmothers brought Southern cultures and ways of living, specifically cooking and quilting, creating these beautiful tapestries. I inherited the joy of quilting from my grandmothers. What I thought to be a hobby has become much more of a metaphor for the work we do. Quilters for justice to end AIDS. When I look around the room, particularly to my left and right, I see sheroes and heroes who came before us fighting for justice on these quilts. When I look in front of me, I see quilters, people like me and many of you who have picked a design, a fabric, a thread, weaving together a vision to end AIDS. will you be a quilter for justice to end AIDS? Dr. Maya Angelou's pen was silenced last year, yet her bold, brilliant, and beautifully crafted words will live forever. She wrote, "We all should know that diversity makes for a rich tapestry, and we must understand that all the threads of the tapestry are equal in value. The more than 1.1 million people living with HIV in the United States are as diverse as the tapestry she describes in her poignant quote. As I master the art of quilting, I can't help but be reminded of the symbolism woven into the diverse designs and fabrics that reflect the many people living with HIV. With each thread of the quilt equal in value, supporting rich tapestry and sewn by people who care. HIV knows no boundaries, no specific race or ethnicity, age, gender, sexual preference, education level, profession, income, or religion. Yet, there are well-documented HIV-related disparities that exist." I knew I was excited to see the updated national strategy emphasize the right people, right places, and right practices. The South today is the right place. The South today is the right time, and we are the right people to end AIDS in the U.S. The South accounts for approximately a third of the U.S. population, but more than a half of all HIV diagnoses. What you see here is a map from CDC of the U.S. and the 6 dependent areas. It displays the rates of diagnosis for HIV infection among adults and adolescents by area of residence in 2013. The states in the darkest shaded area represent areas highly impacted by the epidemic, places like Georgia and Louisiana, who have rates double the U.S. rate of diagnosis, and this is unacceptable. The next map displays people living with HIV. Places like Florida, Louisiana, Georgia, South Carolina, and Mississippi have rates much higher than the U.S. total rate. This too is unacceptable. We must do better, we can do better. We are doing better, but better is not good enough. Our work has been more intentional and inspiring with the HIV care continuum, exploring HIV outcomes along the bars. The National Alliance of State and Territorial AIDS Directors and the National Coalition of STD Directors created the blueprint last summer, recognizing that stigma and other social determinants influence the HIV care continuum before a diagnosis is even made. The bar before the bars. What we need is a patchwork around the bar before the bars, around the isms and the phobias, the social and structural barriers that impede progress before and along the continuum of care. I'm talking about things like racism, sexism, classism, federalism, ableism, ageism, and I'm not talking about addressing these singularly, but intersectionally. Around phobias, homophobia, transphobia, biphobia, and xenophobia. And I don't need you to speak American, because I want to be fluent in Spanish and a few other languages. Where are my Latinos? My Latino brothers and sisters? The most recent Latino Commission on AIDS Deep South report brings attention to Latinos living in many southern states. The Latino populations in South Carolina and Tennessee increased more than 160% between 2000 and 2012. A few recommendations from the report are to enhance healthcare accessibility, availability, and acceptability for Latinos. Build Latino leaders and intensify community mobilization efforts by and on behalf of Latinos. We need a patchwork around homelessness, shame, stigma, poverty, and violence. Gizzy Flower and Alejandra Leo, we say your name. 2 trans women of color who were murdered in Tennessee last year, one in Nashville and the other in Memphis, where news headlines read, "Man found shot to death wearing women's clothing." We must stop the violence against trans women, because trans lives matter. We need a patchwork around the continuum of care, around policies that make PrEP accessible to everyone, particularly our youth, around the needs of people who inject drugs and opioid abuse, especially for folks living in Appalachia and the rural South, routinizing and normalizing HIV and HCV testing. Too many people are getting infected with HIV in the South. The South had more diagnoses of HIV infection than any other region combined in 2013. around harmonizing data systems and measures that will allow us to compare continuums across funding streams, states, and demographics, a patchwork around seamless systems of testing, care, retention, and treatment that eliminates silos and fosters collaboration instead of competition and often confusion. Around leveraging and increasing resources around the Ryan White CARE Act to fill gaps in services by the ACA and non-Medicaid expansion states. Around keeping people alive. Too many people are dying in the South. A recent study showed 33% of people diagnosed with AIDS in Louisiana died within 5 years of diagnosis. What we need is a patchwork of filters for justice to end AIDS. People living with and without HIV, all levels of government, NIH, HRSA, CDC, SAMHSA, grassroots organizers, faith-based partners like Reverend Sanders, and Wayne Smith of Samaritan Ministries, advocates like Mark Hubbard, Josh Ravens, and Larry Frampton, community-based organizations like Sister Love, and the South Carolina HIV and AIDS Council, scholars, physicians, and private industry, people like you. I'm hopeful for patches of innovation across the South. Louisiana is participating in workshops and strategic planning to reduce HIV inequities related to race, sexual orientation, and gender identity, recognizing the need to undo racism, deconstruct homophobia and transphobia. These are the innovative strategies proved by the People's Institute of Survival and Beyond and the California Interaction Institute for Social Change that will help the state achieve health equity and change lives. Then there's Charlie in Virginia, the Comprehensive HIV and AIDS Resources and Linkages for Inmates program. The program provides pre- and post-incarceration case management and navigation services for HIV-positive persons by adding transitional housing, housing assistance, and an 18-week culinary arts training course. Many of their graduates have been employed in culinary arts fields, and some graduates volunteer at the Oasis Food Ministry, preparing a weekly meal that is open to the public, providing people with second chances, empowering them with skills needed to serve their communities and move to self-sufficiency and better health. In Alabama, they're creating innovations in housing with the mustard seed, a handicap-accessible triplex, and by using train car storage units to create homes in rural areas of the state for people living with HIV. Talk about innovation. While many people struggle to think about how to make housing affordable, Alabama is making housing affordable. Who says we can't be innovative in the South? In Memphis, we have the Haven, a safe place that promotes the physical, mental, and social well-being of men of color by educating, equipping, and empowering them to embrace their worth. In a safe space, this program offers HIV and STD testing, condoms, connections to treatment, and referrals. Another program that is innovative and inspires is StreetWorks, Project Uno. You, new, and outstanding. This program focuses on empowering gay men in Nashville. As we all know, MSM of color, especially in the South, have been persecuted, oppressed, and ostracized. How far we have come and how far we have to go when a safe space is innovative. But I'm inspired every day by the work we do. I'm inspired every day by our progress. As part of the care and prevention in the U.S. grant, young black gay men in Nashville and Memphis are defining innovation in their community through social networks and other methods, including social media. Young men are successfully recruiting their peers to get tested, linked, and retained in care. In the third year of this program, over 400 tests were conducted with a 13% positivity rate. These young men, like Darian Bannister, are the new leaders in the movement, redefining the response to the epidemic. In Tennessee, as the director for HIV/STD, we expanded insurance assistance to individuals with incomes below 100% of the poverty level, federal poverty level, and to Medicare Part D individuals meeting our eligibility criteria. We also added hepatitis diagnostics and medications to our array of Ryan White services in Tennessee. Yes, because in Tennessee, we are not only creating a continuum of care, but a continuum of cure. Because only a cure is good enough, especially when we have one. Innovation is everywhere. Open Arms Healthcare Center in Mississippi, Mississippi's first LGBTI health center, exists. In Alabama, physicians who are using telemedicine to treat patients in rural parts of the state, eliminating the barrier of transportation. These programs are quilting a patchwork for change, a patchwork for justice. The culture of data needs to change. Southern states are using the data to care framework to identify people who are out of care and link and re-engage them to care, providing assistance and guidance using patient navigators. Data must inspire action, change, and innovation. These examples are all patches of innovation in the South. So this quilt, this is my legacy quilt. It's made from 14 years of family reunion t-shirts. How many people have family reunion t-shirts sitting in their drawers without a use? There's pictures of 5 generations of women. Me, my mom, my grandma, my great-grandma, and my great-great-grandma. Will you be a quilter for justice to end AIDS? As quilters to end AIDS, we can achieve HIV-related health equity by eliminating the social and structural barriers and by cultivating our innovative programmatic efforts with the same level of care and attention to detail to reflect the richly diverse tapestry of those who are with us. Will you be a part of this legacy? Yes. There's still work. There's still work that needs to be done. A lot of quilts that haven't been started, and there are some that have been started but haven't yet been completed. I charge you to pick a design, a fabric, a thread, and a quilt. Live life like a quilt. Be soft when it's important, be warm when it's cold, be proud to show your true colors, and always scrap together when times are hard. Be a quilter for justice to end AIDS.
Thank you so much, Shanell. Our next presenter has to be the nicest guy on the face of the planet. I had the pleasure of getting to know Cedric when we were working together on the documentary Deep South. And he has become the daddy of Jackson. And he is a wonderful daddy. And I tell Cedric all the time, sometimes I wish you were my daddy, Cedric. So one of my favorite people in the world, Cedric Sturdevant.
Good afternoon, morning, or whatever time it is. Which one do I do? Okay. My name is Cedric Sturdevant. Once again, I'm from Jackson. I live in Jackson, Mississippi. I'm from a very rural area in Mississippi, the Mississippi Delta, a little small town called Metcalf, that, we don't even have stoplights. We have stop signs. That's it. I want you to take a trip with me to Mississippi. How many ever been to Mississippi? Okay. And Mississippi is a very rural state. Have a lot of small towns. And I'm going to talk to you about HIV prevention challenges and care challenges among MSM in our state, and not just our area. A lot of times we focus on Jackson because it's a metropolitan area. It's the capital of Mississippi. But I want to talk about our state as a whole. The rural areas in Mississippi that don't get the prevention messages or the prevention training or any of that. I felt like I was looking down, and I don't want to look down. And we think about education, we say that, education has been out there. But in a lot of our rural areas, a lot of our small towns, we still have people think that you can contract HIV through mosquitoes. Yes, it is funny, but that still happens. We still have people think that you can contract HIV through eating utensils. We was in South Mississippi a few days ago doing a test, doing an HIV testing event, and a young lady got tested, and she said, I want to ask you this. She said, my brother's HIV positive. I have a 2-year-old son. My son liked going behind my brother and eating after him and grabbing his toothbrush. I'm concerned because can he get HIV that way? I was shocked, but at that point I knew that was the time that I had to teach her something and talk to her about HIV. Now, we may think, okay, prevention, we got that down, but we don't quite have it down good enough yet. We talk about treatment as prevention, we talk about PrEP, but we're not teaching the people about PrEP or treatment as prevention. We'll talk to our providers or what have you, but the providers are not spreading the words out to our people. So yes, there's a challenge for us in prevention as far as education and educating people about it. Now, okay, which way does this go? In Mississippi, like I said, it's a rural area. Even in Jackson, being a metropolitan area, you don't have a good bus system. The bus in Jackson do not go outside of the city limits. So if you got someone that's living outside of the city limits and need to go to care and don't have transportation, they're out there. You know, we got people that may live 50 miles away from Jackson and they want to seek health care in Jackson because they don't want to go to a clinic or anything in their area because of, you know, Mississippi. Everybody know everybody. Sally Sue is going to tell my business if they see me at this clinic. I don't want my parents to know yet that I'm HIV positive, let alone I don't want them, they don't know that I'm same gender loving man. So we have those issues of challenges in care trust. We have the issue of trust with our healthcare system, especially black gay men, well, black men in general, have the issue of trust, have the issue of as I said before, in a small town, their business is being told. And we look at stigma. You know, the South is considered to be the Bible Belt. You know, I used to say that we need to loosen up that Bible, that belt, just a notch. Now I say we need to take that belt off, whoop some sense in some of these people so they can stop judging just because the way I look or who I love. They can stop condemning me, you know, allow me to love who I want to love, and they can take, it'll take some of the fear out of a lot of our young same gender loving men, you know, to be bold and step out. You know, don't condemn me to hell. Look at what you do. Think about what you do. Because I know that I'm not going to hell. I know I have a good relationship with God, you know, and that was free. Eliminate the fear that, you know, hey, I can be who I am. I really can be who I am. To the ladies was just on the stage, you know, tears almost came to my eyes. That I wish some of the transgender women that we have in Mississippi was here to see that. You know, now we don't have a big population that I know of in Mississippi, but they're beginning to recognize that transgender women and men do matter. We have a clinic there that assists them. So eliminate that fear by taking away that Bible belt. You know, if you're gonna put it on, teach the right things. And of course, family. By living in the Bible Belt, going to church, you know, all of this, you have family members that doesn't accept a person being a same gender loving person, so they're not going to accept that person as being HIV positive, and that goes back to fear. That person don't want to tell anything, don't want to tell anybody, and that may lead to death. I have a young man right now that I pray for every day. Because at this point in time, because of his family, a few years ago, he hid his medication and he wasn't taking it. And when he finally came to us and told us about himself being HIV positive, by that time he had an AIDS diagnosis. He don't have family support whatsoever. His grandmother just passed earlier this year, and that was the only support he has. And day by day, he wants to give up on life. Now, I know I'm up here talking about the South, and we're trying to, get some things done, get people to recognize, hey, we need money down here, we need some of the fundings down here. We are doing things. But for those of you that's not out in the field, that you're sitting behind the desk and are not dispersing the funds out, come take a ride with me. Get in my car. Go to the neighborhoods I go to. Go to the rural areas that I go to. And you'll see that even though you want to put funding in these metropolitan areas, the rural areas are getting left out. And we need the care there as well. I stand for all of Mississippi. My little hometown is a population of about 1,200 people. And there are a lot of towns in Mississippi that size. We actually educate. Teach our young St. John loving men how to be advocates for themselves. Eliminate that fear. Let them know, stand tall, be who you are, love who you want to, and also create a mentor program. We don't have that many mentors in the area. We don't have that many mentors in Mississippi, period. Mississippi is a great state. I was born and raised in Mississippi. I love my state. But there are some things that we need to do. And we're here from the South, I know. We're not here trying to get divine land played. Trust me, we can do the work. We know we can do the work. But don't take the fork off of our table and expect us to just eat with our hand. Right. Supply us with the tools that we need. Yeah. Thank you. Yeah.
Thank you, Cedric. He's absolutely right. I don't know if you guys remember, but early in the epidemic, the Kaiser Family Foundation did a study about how educated the American people were about HIV, and it was pretty sad. And then they did it again about 3 years ago. And do you know 20% of the respondents still believed you could get HIV from toilet seats, swimming pools, silverware, drinking after someone? It's just terrible, and shame on us, America, for not being more educated. So, I need the next slide, please. No, that's not the right one. There we go. Cedric mentioned how the rural areas are being left out. This information is from the Southern HIV/AIDS Strategy Initiative, and I think it needs to be pointed out that the CDC's funding that is directly funded to the AIDS service organizations and other community-based organizations practices what they call high-impact prevention, meaning they send the dollars to the areas with most of the cases. The idea being that if you can send the dollars to the urban areas where 72% of the cases are, you'll be getting the best bang from your buck. And, that makes sense. But here's the problem. Look at the South. Because of that funding not going to anything but the urban areas, you can see that in Alabama, 70% almost of the cases don't get any help. Pretty much the same in 4 of the southern states. So if we have this severe epidemic in the South, we've got to practice economy of scale. There has to be some money going to these smaller areas. Of course, Huntsville, Alabama doesn't need as much as Miami, but that doesn't mean you don't send anything to Huntsville, Alabama. Okay, that's my editorializing. My next friend who is presenting is Monica Johnson, another dear friend that, So Monica and I, this is kind of like a Deep South reunion. Monica and I also got to know each other during the filming of Deep South. And she does wonderful work in rural Louisiana with her little organization called Hiers.
Yeah.
And I was so happy last night to see her honored as a shero in this epidemic. So congratulations, Monica, and come on up.
Thanks, Kathie. How y'all doing?
All right, how are you?
Now, I'm going to talk a little bit about when they asked me to come and ask me to talk about HIV in the rural South, when they actually asked me to tell my story. And when I started thinking about what part of my story would I tell, I said, I really don't need a slide to tell my story because what you need a slide for? That's just crazy. So I started thinking about my story and I'm like, you know, it's really not about me. The organization never started about me. So I'm going to start with this part and then I'm going to give y'all the other part of me. Some of the stuff I feel like I'm preaching to the choir because I know this was the last full day, last day of the conference. A lot of people, a box lunch, a lot of people were not going to be here, but y'all who are here, some of this stuff is repeated, so I'm going to go real fast, then I'm going to go real slow so y'all can hear me. The more things change, the more things stay the same. That is clear. I don't have to explain that. Y'all know. Y'all know. And let me be real clear when people, I have to thank my sister for talking about Louisiana, but when y'all start talking about the South and the rural area, Louisiana, I live 5 hours from New Orleans. I don't live in New Orleans.
All right, come on.
And I don't have the same services that the people in New Orleans have. The majority of the money is going that's going for southern states and not coming to where I live. I need help. It's the same virus, but a different epidemic. It depends on where you are, what you get. I hate to say that in 2015, the way things are in our area. Addressing the epidemic in the rural South, this is what Heroes has. Very low literacy, the demographic match for peer-driven support, on-the-ground prevention education, and cultural relevance. Now, what we urgently need is funding that's directed to the rural South. And let me be clear, because sometimes this is slow part. You can't send money to somebody who don't come to my area to help me. So let me go back. So this is the part I gotta talk slow on. Let me tell you my truth. My truth. What we don't have in Louisiana is a lot of stuff. We have unlimited access to a lot of things, like discrimination, stigma, excuses, indifferences, and a whole lot of judgment. Despite what a lot of you all think, I have been living with HIV. I'm headed into my 4th decade. So I was here in the beginning. This is not new for me. And I get very agitated when people ask me stuff that I just think is so crazy. Just because, I don't want to say it's because I'm black. I don't want to say that. I don't want to say it's because I'm a woman. I don't want to say that. I just think sometimes people don't think about what they say before they say it. Now, if the shoe fits, I want you to wear it. But if it don't, you just walk on out with it. My last thing I want to say is it's probably not the people that's in this room, but since my organization has been around, I can honestly say that I think this is the hardest field to work in, Some of the people are not nice. I'll just venture to say evil. Some people don't want to help you. Some people are very, very angry. And I have said publicly before, if it was no me, there would be no need for you. I hear a lot of people talking about ending the epidemic, and I really would like to see that. I hope I would live to see that. But in my real mind, I really don't think I'll be here when that happens. Because you cannot talk about ending the epidemic and not talk about ending the epidemic in the South, and especially the rural South. Thank y'all.
Go, Monica. To introduce one of my dearest friends. I would call Robert Greenwald an unrelenting warrior, and he is certainly the king of all things access to care. He's partnered with us on so many things, and he is so passionate around Medicaid expansion in the South. I consider Robert an honorary Southerner. So welcome, Robert Greenwald.
Good afternoon, everybody. Okay, so I have about 10 minutes to provide an overview of healthcare reforms in the southern states. Sadly, my presentation is going to include about 2 minutes of good news about those who are newly insured in the South. And the rest of my time is going to be spent describing the decisions that have been made that have left so many people living with HIV in the South outside of health reforms. I'm also going to briefly try to describe some strategies for addressing the extremely high rates of uninsured that currently exist in the southern states. To start, the good news. As a result of health reforms, over 16 million Americans since the start of the Affordable Care Act have transitioned from being uninsured to having health insurance. That's an incredible accomplishment. It's difficult to know exactly how many people living with HIV are among the newly insured. We don't have great data on it, but what we do have is information about the people that are in the Ryan White ADAP program. And what that shows is that 38% of ADAP enrollees, 68,000 previously uninsured people living with HIV on ADAP are now newly insured as a result of health reforms. That's 48,000 people that are newly on marketplace private health plans, almost every one of them receiving subsidies to try to make them more affordable. It also includes 20,000 people newly on Medicaid expansion. And this is really great news because it means that our limited Ryan White program resources can stretch further to fill gaps in care and gaps in affordability, and also to help those that are left outside of health reforms like immigrant communities. Now, again, most of the presentation, the bad news. As a result of the failure to expand Medicaid, 20,000 people on the ADAP program alone, let alone thousands of other people not on the ADAP program, are now left without health insurance, and this is particularly important in the South. As you can see here, people in the Southeast aren't the only people left behind. Folks in the middle of the country also live without Medicaid expansion. But the reality is the overwhelming majority of people living with HIV left behind because of not having Medicaid expansion are concentrated in southern states because these are the states with the largest populations. Overall, it's estimated that 25% of people in the coverage gap live in Texas alone. 18% live in Florida, 10% live in North Carolina, and 8% in Georgia. Now, the failure to expand Medicaid isn't the only reason why people in the South have such high rates of uninsurance. As you can see from this slide, in the southern states, in the traditional Medicaid program, that's the mainstream program, adults without children are generally ineligible for the program at any income level. In many southern states, parents are ineligible if they earn more than $5,000 a year. With states like Alabama and Texas and Mississippi, you can't earn more than $2,000 a year and be eligible for Medicaid. So high rates of uninsured, more limited traditional Medicaid eligibility, government indifference, and the lack of Medicaid expansion combine to mean that 89% of people in the coverage gap in the United States live in the Southeast United States. That's outrageous. And that is why we need Medicaid expansion, and we need targeted resources towards the South. So what can we do to close the coverage gap? To start, let me be clear, I don't have an easy solution. But frankly, from my perspective, what makes most sense is for all of us to do everything we can to fight voter suppression in the South, to mobilize folks to vote, so we can throw the clowns out of office who are denied access to care. Polls show that the overwhelming majority of people in southern states are with us. 2/3 of adults surveyed in Alabama, Georgia, Mississippi, Louisiana, South Carolina support Medicaid expansion. In addition to widespread support from the general public, increasingly we have support from hospitals, chambers of commerce, business leaders, diverse civic and social organizations. We need to demonstrate to elected officials in the South that their jobs are at risk. They are part of a shrinking minority. The ACA is here to stay and increasingly has bipartisan support. 10 states with Republican governors have already expanded Medicaid, and the results are increasingly clear. Expansion leads to improved individual and public health outcomes, and it's a strong economic engine, generating significant business activity and jobs in states. What more do Republicans want? Clearly, each southern state needs to tailor its own message, but a general theme is clear. The Obama administration will allow states to move forward with what's called a premium assistance waiver. This allows them to do a privatized version of Medicaid expansion. With a premium assistance waiver, the politicians get to use the rhetoric in saying, we're not doing Obamacare, and then use the federal funds to provide health care to people in the southern states. Without a premium assistance waiver, the status quo continues. The southern states' federal tax dollars end up going to pay for health care in Massachusetts, New York, and California. That's not where the health care is needed. We need to make sure that resources and Medicaid is targeted to the South. Now, as I said at the start of my presentation, some of the good news is that we have marketplace private health insurance. But there are some alarming trends in the marketplace private health insurance plans in terms of coverage and affordability that are increasingly threatening and undermining healthcare access for people living with HIV. While we don't have statistics specifically on HIV, what I can tell you is, national statistics or just statistics on the South. We did a study on 15 states, and what we found now is that 28% of the insurance plans don't cover all HIV medications. 19% of the time, they now don't cover single tablet regimens. Some of the plans are charging so much co-insurance for people living with HIV that the health plans are $3,000 more for a person living with HIV than for the general population. This is unacceptable. Now, the bad news is, in the southern states, they're not always using their Ryan White ADAP program to help meet the cost of health insurance. Of the 6 states that don't fully provide ADAP assistance to help make new health insurance affordable, 4 are in the Southeast. One of the 2 states, Texas, the state with the 3rd highest number of people living with HIV in the United States, and they don't use their ADAP program to help pay for premiums for co-insurance. North Carolina and Mississippi don't help people living with HIV pay for their premiums. Georgia doesn't help with prescription drug co-payments or co-insurance. We have to fight to reverse this trend. We need stronger ADAP coordination in the South, and more important, we need to hold the government and insurers accountable if we're going to make private health insurance work for people living with HIV in the South. Now, the good news is we're starting to see this happen. In Louisiana, for example, advocates successfully led a battle that led to the creation of federal regulations that require insurers to accept Ryan White payments. Florida advocates successfully led an effort that now dramatically reduced unfair and discriminatory practices in the private insurance market. The insurance plans no longer charge high co-insurance. We need to replicate these victories in all the southern states. So just to end, to say, if you want to help with this effort to hold government and insurers accountable for making the promise of health reform a reality for people living with HIV in the South, there is a way to do it. Join the Southern AIDS Coalition. Join the Southeast AIDS Strategy Initiative. Both organizations are doing an incredible job to try to fight back against these unfair and discriminatory practices in the South. If you know of discriminatory or unfair business practices in either public or private health insurance, let us know or go to speakup@hivhealthreform.org. And finally, just to say, everywhere in the nation, because of the Affordable Care Act and health reforms, every other region other than the South, uninsured rates are going down. I'll end by saying once again, we all have to work together. It doesn't matter where you live. We have to put an end to the Southern healthcare crisis. The lives of our brothers and sisters in the South depend upon it. Thank you.
Thank you so much, Robert. You know, being the moderator is kind of fun because I get to inject whatever I want to interject. I would like to point out, I don't know if she's here today, but the director of our health department, HIV division, Sharon Jordan, our leadership has been able to provide platinum Blue Cross Blue Shield health insurance coverage for our folks on the ADAP program. So thank you so much to the Alabama Health Department. And I would also like to add, you know, when this all started and AIDS Alabama applied for a statewide Navigator grant, we were very fortunate in that we were the only AIDS service organization in the country to receive one. And for a state that did not want the Affordable Care Act, in Alabama now, 270,000 people have health insurance through the insurance marketplace. That's more than 5% of our state's population. So I think Alabama does want Obamacare. My next presenter is a wonderful young man who has lived the horror of HIV criminalization.
Yeah.
Robert has become one of the leading voices to stop the madness.
Yay, Robert!
Through his work with the SERO project, we hope to help people to understand that HIV is not a crime.
Yay, Robert!
Thank you, Kathie, for that introduction, and thank you all for allowing me the opportunity to be here today to talk about HIV criminalization in the South. I have no slides today because I don't want to bore you, but I just wanted to just share a few words and then I will be on my way. I just want to say that I am a product of the South. For those that are not familiar with me or my background, I am from Louisiana. I am, right from Louisiana. I'm a person living with HIV, going on 12 years this year. And what else can I say about myself? I'm assistant director of the SERO project, where we're a network of people and living with HIV and allies fighting for freedom from stigma and discrimination. What I want to share with you is that I was prosecuted back in 2009, was convicted rather in 2009, for intentional exposure to the AIDS virus. I was sentenced to, I've served 6 months in Louisiana prison, and I am still a registered sex offender here in the U.S. In Louisiana, it required 15-year registration, and everywhere I go, every state that I move to, I have to check in with law enforcement there in regards to sex offender status registry. So my experience is not yet over, even though I was sentenced and went through prison time, it is not over. And the same will go for others that live here in the South and anywhere in this country that will experience HIV criminalization. The experience of HIV criminalization is not different in the South than it is anywhere else. However, the SERO project had conducted a survey back in 2012 where we surveyed at least 2,000 people living with HIV and their attitude, to examine their attitudes around HIV criminalization. And like most people, most believe that it is a moral and ethical duty to disclose one's status. However, a lot of people may disagree is the fact that we don't agree that it should be enshrined in the criminal code, that it should not be against the law to not disclose your status. And I agree with that. And I agree with it wholeheartedly because of the advances that have been made now that, yeah, it's not a good experience to hear that you're being diagnosed or you contracted HIV. However, once you get through that cycle of thought and pain and emotional heaviness that you feel, the thing that people need to know that they need to be given hope. And I really feel like that we don't do ourselves a good justice when we don't give people hope, and we have barriers other than the original social determinants that we have to live with every day. But when there's the issue of the law, and it's made criminal because of something that's within you that you can't change, or something about you that you can't change, that is very disheartening, and it's very scary for someone who is newly diagnosed, and even it should be for those of us that are continuing to live with HIV. One person's HIV is no different than the other. I understand that there are different strands, but in essence, HIV is HIV. And no matter how you contracted HIV, no matter where you live in this country, the law does not exempt you from being prosecuted. You are not exempt from being prosecuted. And even in the gay community, even within our HIV community, a lot of people feel like that there are others who are bad people, bad gays or bad people living with HIV. There are people who believe that these laws should exist. But I tell you, we don't need HIV-specific laws. We have enough general criminal laws on the books that can handle this situation. And as I said, we all can agree that we should be able to disclose our status, but we're not able to do that in this day and time that we live in. We want people to disclose, and we need to make it legally safe for them to do so.
Yeah.
My thing is, if we know that we're dealing with stigma and discrimination, then how do we expect people to be able to disclose their status? How do we really expect people to do that? I mean, does anybody have the answer out there that how do we really expect people to do that? It is very difficult. I was 5 years into my own diagnosis before I was ever faced with the threat of being prosecuted. It happened 5 years after, so from the first time that I found out about my status up to 5 years later, I was dealing with the process of how to disclose, when to disclose, and never did I expect to be prosecuted because of having HIV. I never expected, I didn't know anything about laws, I didn't know anything about criminalization of people living with HIV. Frankly, I didn't even know anything about HIV at the time when I was diagnosed. And so I had to learn a lot over these past 12 years, and I definitely have to learn a lot in these past 3 years in regards to criminalization. But I just think about all the things that have been said today regarding statistics and populations, that what is it going to take for us to really get serious about this issue? And I think I applaud everyone that's finally put this on their agenda and made it a priority in many different ways. But a lot of people still think that this is right, to have people prosecuted for a disease. And I'm reminded that I was once that person who had contracted HIV that found out about his status. I'm not just a person that's been prosecuted. I am also a person who had found out about his status as well. So I definitely understand the pain, I understand the misery that one goes through. But I also understand the pain and misery when you have to face prosecution. And that is nothing nice. It is not nice to be a convicted felon. It's not nice to be a registered sex offender when everyone has to know about how this came about is because of your HIV status. And so it's just many layers and layers of labels that one has to live with. And I'm not standing here just speaking for Black gay men, but I also represent that this issue affects our trans community, it affects sex workers, it affects women, it affects immigrants, it affects all the marginalized populations, and we have to work together to recognize that there is intersectionality that happens, and a lot of us are impacted in more ways than one. So what can we do about this? I'm just going to give you some solutions to just educate yourself about this issue. Talk about it amongst your networks, amongst your community. And I know my time is almost up, but I want to take this moment to acknowledge how an organization or an app or agency took the opportunity to give me an opportunity to employ me, simply based on an experience that I've had around criminalization. I went to the Philadelphia Center, and a lot of them are represented here today. And I just wanted publicly to take this time to thank you, Philadelphia Center, for believing in me, especially at a time when I came to you as straight out of prison, trying to figure out what can I do to volunteer, to learn more about HIV, to do more to help my community, to help other people like myself, who are Black and gay or otherwise, who needed some guidance and understand as to, what is HIV about? Because not a lot of people know about HIV. Even though they're diagnosed and living with it, they don't know a lot about it. They definitely don't understand clearly the legal implications of what it means to be living with HIV. And so the Philadelphia Center gave me a chance. When I shared with them about my opportunity, they didn't back off. They really supported me, and they went to as far as to create a position for me, and for me to be able to connect with other people that are living with HIV, other Black gay men, young Black gay men, and not only share with them about prevention, but also to go a step further and to talk to them about HIV criminalization laws. And I feel like that's a piece that's missing in all of this prevention, community-based organization, SERO organization work, that you gotta go a step further and talk to people about HIV criminalization laws and giving them clarity as to understanding what that means. When they're tested positive, explaining it to, don't just tell them, oh, there's this law, you gotta break it down. And before you can break it down, you gotta understand, you gotta educate yourself about this issue, because how can you help and support the people that you're supposed to be working for, with, and then you just, when it comes to them being prosecuted, they're just kind of left out there on their own with no resources or representation to support themselves. And so I just wanted to publicly thank the Philadelphia Center, because you went as far as creating a position, an advocacy coordinator, just to work on this issue alone. And so even if you don't have an agency or you're not have the capacity to do that, you as an individual can take it upon yourself to learn about this issue. And I applaud all of you, those of you who have made points in your work to address this issue, to bring it up, to mention the words HIV criminalization, and to recognize the injustice of it, not just for people living with HIV, for all people who are marginalized by criminalization. So thank you for this time, and I really appreciate this opportunity to talk about HIV criminalization here in the South, and I hope that we can continue to work together as allies and a strong support network for all people in all communities that are marginalized to criminalization and living with HIV. Thank you.
Thank you, Robert. Before we end, there are two people I would really like to acknowledge. We wanted to have plenty of time for the trans women today because that was a very important presentation. And so two of our presenters stepped back and decided not to present. And they're two of our great leaders. I would like to thank Carolyn McAllister with SASI, the Southern HIV/AIDS Strategy Initiative, and Nick Carlisle with the Southern AIDS Coalition. And I really urge all of you, if you want to do something, take some action, join SAC and SASI, get our newsletters and all of our advocacy updates, because we need your voices. I think I have a final slide here. The path that leads to the end of the HIV epidemic, and that's the path we all want to be on, right? That path goes right through the South. We are not going to end this epidemic without dealing with half of the people living with HIV in the South. Now, I understand that there's a temptation, and I've heard some of my colleagues say this, why should we support an area that elects dumbass politicians who won't expand Medicaid, who won't support our HIV portfolio? You know, I have to laugh a little bit. I'm going to be kind of bad here. Our governor, who is a doctor of all things and won't expand Medicaid, He's in trouble right now because he's been flying the state jet around to see his mistress. That's typical. Yes, we do elect these dumbass politicians. But who gets hurt when we punish the South for that? Who gets hurt? It's the people. It's the individuals living with HIV in Alabama and Mississippi and Georgia and all of our other deep South states. So we have to remember that. And thank God people didn't say, well, let's forget about the South during the Civil Rights Movement. You know, we needed some help in the South during that time. Sometimes you have to bring the South along kicking and screaming. But by God, we're going to keep fighting until we do. So remember, the numbers don't lie, and it's time to end the disparities. So I also want to invite everyone, there are desserts in the exhibit hall. Please go by and see the sack and sassy boots. And I have one last slide, I believe. There was a young man in Africa who was the symbol of HIV, much as Ryan White was in the United States. His name was Nkosi Johnson. And oftentimes in the South, we joke about seeing what we can do, how much we can do with nothing, right? You all familiar with that? But I loved what Nkosi had to say because I think it's very applicable to the South. He said, do what you can with what you have, in the time you have, in the place you are. And let's all continue to do that until we end this damn epidemic. Thank you.
Guess what, ladies and gentlemen? Desserts are in the exhibit hall. Thank you, Southern AIDS Coalition and partners. Again, desserts are in the exhibit hall. This is the last 3